of upper limb and the plain type of synovial joint. Bones involved in acromioclavicular joint are lateral part of clavicle and the acromion process of scapula. Next is articulating surface. AC joint is the articulation between small facets present on the lateral side of the clavicle and the acromion process of the scapula. The articular surfaces are covered by a fibrocartilage. This joint cavity is subdivided by an incomplete wedge-like structure known as articulating disc. Due to the variable articulating configuration of this joint, intra-articular movements are not predictable. Next is about joint capsule. The joint capsule encloses the two articulating surfaces. The joint is enclosed by a loose fibrous layer that is lined by a synovial membrane, bounding the synovial cavity present over there. It is a thin, less fibrous sac attached to the margins of the articulating surfaces. The posterior aspect of the joint capsule is reinforced by the fibrils of the trapezius muscle. Now next will be continued by Jaina.
So let's talk about the ligaments present in the AC joint. Alright, so the ligaments, there are the two main ligaments present in the AC joint that strengthen and stabilize the joint. First is the acromioclavicular ligament. It runs horizontally from the acromia to the lateral clavicle, and that we can see here in the diagram. This is the acromioclavicular ligament of the green color. Alright? Then it covers the joint capsule and reinforces its superior aspect, means upani taraf. Alright, next. Then the second ligament is the coracoclavicular ligament. It is the main primary supportive ligament. It is largely responsible for suspending the weight of the scapula and upper limb of the body. Alright. Then it is the strongest ligament of the upper limb. It has the two parts. First is the conoid part. It is fan shaped. Then it runs vertically from the conoid process of the scapula to the conoid tubercle of the clavicle. Conoid tubercle is present inferiorly in the clavicle here, and we can also see that in the diagram here. This is the conoid tubercle. Correct? Then its second part is the trapezoid ridge. Trapezoid part, which is quadrilateral in shape. It is the horizontal fibrous band that extends from the upper surface of the coracoid process to the trapezoid ridge on the inferior surface of the lateral end of the clavicle. And also in the diagram we can see the trapezoid ridge of the clavicle, which is present on the lateral part of it. Now let's talk about the movements. The acromioclavicular joint allows the two type of the main movements. First are the axial rotation and second is the anterior posterior movement. Then these movements are associated with the movements of the scapula at the scapulothoracic joint. Next. In the diagram we can see the movements related to the AC joint. See, here first it is the external rotation, internal rotation, downward rotation and upward rotation. These both are the axial rotations performed around the AC joint. Here from lateral view we can see that posterior tilting and anterior tilting from the lateral side. Here also my friend. And in this here we can see the posterior rotation performed by the AC joint. This is the elevation, back taraf retraction, agani taraf protraction and depression, je niche ni side. Sure. See, this is the posterior rotation, which we have seen in the diagram. આ clavicle છે અને એ પાછળની તરફ આમ રોટેટ કરે, એ posterior rotation. Then જ્યારે આપણે બ્રીથિંગ કરીએ તો આપણી ચેસ્ટ એનલાર્જ થાય, એટલે આપણો સ્કેપ્યુલા પાછળની તરફ આમ જાય. Okay, so આ છે external rotation and then internal rotation. હજી inward એના exactly આમાં point clear નથી હજી. Sorry ma'am. Then talking about the neurovascular supply, so the vessels which supply the AC shunts are the first we talk about the atrial supply, which is run by the two vessels. First is the suprascapular artery, which arises from the subclavian artery, and other is the thoracoacromial artery, which arises from the axillary artery, and that we can also see in the diagram. So this is the suprascapular artery, and here is the thoracoacromial artery. Now talking about the venous supply.